I am thrilled today to be joined with Charlotte Mbuh from Cameroon, immunization healthcare worker who not only works to immunize children in her country, but also connects with immunization professionals around the world. So, welcome, Charlotte. If you could start with introducing yourself, that would be great.
Thanks, Martha, and it's a real pleasure for me to be here. I'm Charlotte Mbuh, as you just said, and I'm from Cameroon. I actually live in a town in the southern part of the country called Ebolova, but I was born in the northwest region, one of the English-speaking regions of Cameroon. I am a second of six daughters, and um, I went to school, studied at the University of Boya, medical laboratory sciences, but I fell in love somewhere along the line with community health. And today, my real passion is, advocating for vaccines and immunization.
Great to hear.
Thanks, Martha.
Yeah. I think, we'd all love to hear a little bit about what led you. You talked a little bit about your studies, but what really fuels your passion to be a healthcare professional in circumstances that probably aren't always that easy?
Okay, so it's an interesting story because when I was a kid, I was usually sick, and my dad sent me to live with an uncle that was a nurse because he said, "Okay, you have to go stay with him. He'll know maybe have better ways to take care of you." So while there, I got introduced into the day to day care, the jabs, the injections, the tablets, and all of that. So while growing up, there was already that consciousness that healthcare is important. And somewhere along the line in high school, I started volunteering for an association, that's the Association for the Fight Against AIDS in Rural Areas. And we were doing more like a sensitization of young people on HIV/AIDS prevention. So that was in high school. So I went to the university and decided to study medical laboratory sciences. But my real passion wasn't to work in a clinical setting. I really wanted to, that contact with the community, that community sensitization and information really drew me to engage myself in community health. So when I was recruited into the public service in my country, I was sent to work at the regional delegation of public health in the South region. And I entered into administrative work, administrative health, and that opened the door for me to get involved in public health. That is going to communities and doing training of community health workers, just telling them about different health situations, including immunization. I became a regional supportive supervisor for the immunization program sometime in between 2010 and 2013. And in 2013, I was officially assigned to work in the immunization program. This coincided with a polio outbreak in my country, Cameroon. So I just sunk deep. I find myself sinking very deep and actively in the immunization sphere in my country.
Wow, great. Well, it's fascinating to hear that you not only went on because of your uncle's influence to work in public health, but that you also, teach and train others. And I think we'd all love to hear a little bit more about the polio outbreak in 2013. Can you touch on that, like how you found out and identified cases and how you reacted? I assume had to react pretty quickly to immunize children who had been exposed.
Yeah, so it was really quite interesting because after about a number of years without any cases of wild polio virus in Cameroon, and we're at a point where we're like, okay, we could be certified as being polio free, four cases of wild polio virus were detected in the west region of the country, putting us immediately in an outbreak situation. And that was towards the end of 2013. And in January 2014, one case was detected in my own region, that's the South region, in one of the health districts that's called Kribi, and that opened up a door to many to a massive response to that outbreak. So we had monthly national immunization days against polio. We had consultants coming from UNICEF, from WHO, CDC top consultants come to support us to face and to manage this outbreak. So during that time, as EPI data manager, as well as epidemiological surveillance officer at the region, I was actively involved when it came to planning and implementation of these outbreaks, as well as supportive supervision of the campaigns, the supplementary immunization activities on the field. So I was constantly going down to the field to, first and foremost, we had to train district health staff. We had to train community health workers that were going to be responsible to sensitize the communities, and also to administer the 2 doses of the polio vaccine. So it was a great and immense learning opportunity for me, because just in 2014, we had about 10 national immunization days, and in 2015 we had about 4. So, but to me, what was really remarkable was the lengths that people went to ensure that children were immunized. I met when I went for supervision, there were times I would meet community health workers that would walk on foot over 10 kilometers, 20 kilometers, just to administer the vaccine to children in areas where with little electricity, basically no road infrastructure. So the difficulties that they went through to administer those vaccines just increased my passion and my engagement to advocate for vaccination.
Wow. Well, that is quite a story. And it's interesting to hear how inspired you were by these healthcare workers. I know we talk a lot at Shot at Life about the dedication, about the difficult conditions, but people that are determined to make sure children are protected against these diseases because they've seen outbreaks, whether it's polio or measles, and they know that it can be, life-threatening in some cases or paralyzing. I wonder if you could touch a little bit more, Charlotte, on some of the obstacles. You talked about some physical obstacles, and I know you've got some great photos also for that. But what are some of the obstacles that that you faced and healthcare workers face in immunizing these children? And I think there are probably some overall obstacles, but then also how the pandemic may have exacerbated some of these conditions.
Oh, yeah, thanks, Martha. So, in terms of challenges, in terms of obstacles, there were many. We could look at them from the perspective of logistics, that's availability of all the equipment, the material that is needed to store vaccines, like cold chain equipment. They were not always available. So, because to be able to administer vaccines, they need to be stored in the right conditions for them to be able to protect the children. And to store those vaccines, we need the cold chain equipment. And in many situations, they were not usually available. So people had to travel from their health facility to another location to store their vaccine and go pick them up to get them. Yeah, there was the issue of accessibility I mentioned earlier on, and maybe we could pull up some photographs of some of our road infrastructure, accessibility to some of the site. Imagine even when you have a vehicle that is made for the terrain, for this kind of terrain, but accessibility is still a problem, then we can imagine what it is for those healthcare workers that have to get the vaccines to their communities, to the children. Many a times there are situations where they have to walk on foot. So there is that issue. Now there's also a concern with capacity building. Yeah, because things are changing, times are changing, and there is evolution in new vaccine introductions and all of that. So many a times when there is staff turnover, so we have new staff that come in, they need to be trained, and at times the resources to ensure that training, they are not always available. Resources for supportive supervision, because it is important to go down on the field to check what is happening, so and ensure even during supplementary immunization activities, that during campaigns we have to go on the field to watch to see how the vaccination, how the campaigns are taking place. And I just reminds me of a particular story. In 2018, we had a child that died, a suspected case of neonatal tetanus in one of the localities, one very small community in my region. And so we went down to investigate that case of neonatal tetanus, and we got into a village. That was in 2018. And remember, I mentioned earlier that in 2014 we had lots of polio vaccination campaigns, as National Immunization Days. So we went down to that community and we realized that the last time that a vaccination team had passed in that community, because the road infrastructure was really very bad, was in 2014. And we saw it was marked on the door, because during polio National Immunization Days, there are markings, writings on the door to indicate that a vaccination team has passed and has administered vaccine to children. So it was interesting for us to find out that the last day that was marked on those doors was in 2014. And so we could now understand that the mother whose child died, probably because of neonatal tetanus, had not received the tetanus toxoid vaccine when she was pregnant. She had not received the vaccine, and so she gave birth to her child at home with a traditional birth attendant who also happened to be her mother. And the child's umbilical cord was cut off with a razor blade that we have no indication that it was sterile. So in that community, when we discovered a good number of children who had not received any vaccine. The good thing is, when we're going there, we took a vaccinator, as you can see on the picture on the screen. We took a vaccinator with a vaccine carrier to carry out catch-up vaccinations in that locality, and we're able to reach a good number of zero dose children. That's children who were born between 2014 and 2018 who had not received any vaccine before, or had received or had not completely been immunized. So to me, that was a remarkable story, because number one, there was a problem of accessibility. Number two, there was a problem of human resource. It means there is the closest health center, the closest health facility to that locality was over 10 kilometers away, and it had only one personnel. So he could not cover all of the villages in his area with the vaccination services. So those were some of the obstacles that we faced. But beyond that, we now had the COVID-19 pandemic that hit us in 2020, and came with a wave of dis and misinformation that caused turnout in health facilities to drop drastically. We had people that were afraid to come to health facilities, or mothers that were afraid to bring their children for vaccination services for fear of catching the COVID-19 virus. And so there had to be a lot of sensitization, a lot of community engagement to change the status quo. But the good thing is, with the introduction of the COVID-19 vaccine, with engagement with local authorities, engagement of community groups, women's groups, religious leaders, and all of that, sensitization, it was possible to get people to. But up till now, there are still some groups of people that still do not accept the vaccines, COVID-19 vaccines, because of misinformation on social media, because of side effects, what they have heard from others about side effects, because of religious beliefs, and you name it. So, but I think with resources, with sensitization, most of these challenges can be addressed. Thank you, Martha.
Wow. Thank you so much. Those are some real obstacles, and I can imagine the pandemic made things, with all the disinformation, that made it even more complicated. Charlotte, you and I have had the chance to speak, and we can feel that you have a real passion for your field, and you said a lot of it comes from inspiration from others that you work with. Can you touch on maybe a particular story about another healthcare worker, either within Cameroon or that you're connected to across your network through the Geneva Learning Foundation, that really inspires you? We have a group of volunteers that I think would love to hear some of these stories about healthcare workers in the field. Could you share one with us?
Yeah, gladfully so. And I forgot to mention earlier that since 2020, I have actually also been working with the Geneva Learning Foundation. We are an organization that seeks to lead change through digital learning and trying to solve some of the stubborn problems that the world faces, and notably one of them, where one of the areas in which we have worked seriously over the past few years has been immunization. And the great thing about what we do is the ability to connect with thousands of immunization professionals from across the world, across system levels, and across organizational affiliations. And so, with my interactions with some members of our network, I came across a nurse in Senegal, and she shared a story that actually marked me. There are quite a number of them. There are some other stories from DRC, from Ghana as well. But let me just share this story from Senegal. It's a story of a midwife that was transferred from a city hospital to a local a community health facility where she was sent to lead. And on going there, she had very little prior experience with immunization. So when she got there, she didn't know. She found out that the immunization coverage was very low. The turnout in immunization services was quite low. She didn't know much about how to run the session, how to do reporting. But because there was already this network, this peer support network that had been built, she reached out to a fellow immunization professional in Chad and shared her problem. And through WhatsApp, they were able to communicate. And the colleague in charge shared with her some resources, how to organize a vaccination session, how to report, how to fill the various tools like the immunization register, the tally sheet, and all of that, how to analyze her immunization performance. So she was able to get that knowledge, and also how to communicate around immunization. So what she did is she went down into the community and gathered the women who had children, who had her target population, those mothers, and she began to call them her immunization angels. So what she did, she told them, okay, when you get your children immunized, when you go back, share the story with other women who are like you. So when those women, they went back to their communities, they'll go and say, okay, they'll look at other women who are children who have not received their vaccine, to say there is somebody who is ready to come down and administer vaccines to the children. So when her immunization angels will go down to a community and they are able to gather a number of women and their babies, they will come back to her and tell her, in this community we have this number of children. And so she will make a plan and go down to that community to catch up those babies and also to sensitize those mothers. By so doing, she was able to move from having less than 5 children per vaccination session in her health facility to having about 30 per vaccination session. So that was to us an incredible story, not just because she was able to use ideas that she got by sharing with other members of the platform, but also seeking support from another peer, a colleague in a different country whom she has never met physically. So that to me was a very fascinating story.
Oh, well, I find it very inspirational. Thank you. Like you said, someone from Senegal can reach out to someone from Chad to get the resources she needs, and someone who's a midwife who is really not used to administering vaccines and can get all the resources that she needs. And of course, I love that term, immunization angels.
Yes.
On a little bit, a different kind of angel, but Charlotte, you probably know at Shot at Life, we have volunteers from all across the US who reach out to their policymakers to make sure that the programs, a lot that you work with, of UNICEF and WHO and Gavi, that they have the resources that they need in order to support healthcare workers like yourself. Could you speak a little bit about why it's so important, this work, to make sure that these organizations and these agencies have the proper resources to be able to carry out the work that they need to do protecting children around the world?
Yeah, yeah. Really, it's important. I'm going to highlight 3 reasons why I think and governments need to support the agencies that promote immunization. First and foremost, when we had the polio outbreak in my country, we wouldn't have succeeded to tackle it had it not been for the support, the multiform, multi-sectoral support that we got from global stakeholders like WHO, like UNICEF. From that is personally in 2015, our my direct boss, the EPI manager, was not available, and I was forced to sit in and to coordinate immunization activities in my region. Had it not been for the support that I got from WHO and UNICEF consultants that were assigned to our region, we will not have been able to succeed in all of the activities that we organized. Because why? They came with logistical support, they came with technical know-how, they came with experience from elsewhere that we needed at that time, because we had to learn fast, we had to move fast, and we had to act fast in order to address the critical challenge that we were facing as far as immunization was concerned. And that was made possible by the resources that these organizations, WHO, UNICEF, and Gavi, made available. And I'm sure that these organizations, they depend from those countries like the US that set aside resources to support them. The second thing is the world has fast become a global village. So one thing, what affects someone in a remote community today in Cameroon can tomorrow affect someone in the heart of Charlotte in North Carolina in the USA. Why? Because of the constant motion. People are moving. Not only people are moving, goods are moving. And when they are moving, viruses and other causing agents, they don't need a visa. They just have to be carried along in someone's luggage, in someone's clothing, whatever. So when you support immunization in one part of the world, you are actually also contributing to protecting yourself, protecting your children and future generations. So that's why I think it's important that we know that because we are one world, we need to put our hands on deck and work together to protect that world and the future of the world. The third thing I would like to talk about also is, and just to conclude on my previous point, COVID-19 is a case in point that I won't belabor here, but I think we, the world, the global community, learned a lot, and the response to COVID-19 through the vaccine introduction, being able to handle it and tackle it so far is because the world came together to solve this complex challenge. Now, lastly, I would like to say that beyond the jabs, that is the vaccines that are acquired to administer to children, there is a long chain of people that are involved. And some of us who work in the global space, that is trying to link those local practitioners to the global space, to global stakeholders. What I'm trying to do today, it is thanks to the support that we get from funders, from donors, that enables us, that enables me to be able to connect with health workers in Haiti, health workers in the Philippines, health workers in China, in India, health workers in Great Britain, health workers in South Africa, all over the world. We are able to connect as immunization professionals. We are able to share experiences. We are able to learn from one another, and we are able to take forward one agenda, which is the agenda for immunization, which is to ensure that every child everywhere receives the vaccines that they need. And for us to be able to do that, we need the support. We need support from all the stakeholders that can put their hands on deck to make sure that this agenda moves forward.
Wow. Well, thank you so much. And thank you for teeing up Immunization Agenda 2030, because it's something that we're certainly going to cover more in our summit. But I wanted to thank you so much, Charlotte. You're an inspiration. You clearly have a passion for the work that you do. I've been inspired talking to you, hearing your stories, and I hope that that will be the same for our champions listening. And just thank you again for the work that you do and for taking the time to be with us today.
Thank you so much, Martha. It's been a real pleasure. Thank you for thinking about me and for inviting me. And I just want to wish you and all the champions, the Share Life champions, an excellent summit. And I hope that when they shall go to speak to those who will decide on the future of immunization, that their words are going to create an impact, and that it's going to cause a ripple effect, even touching the children in the most remote areas in the world. Thanks.
Thank you.